Hi, my name is Alex Murrieta, and I am currently enrolled in the Clinical Medical Assisting CTE-ROP Riverside County Office of Education at Murrieta Regional Learning Center. Within the next year, I plan on graduating from high school and going to the University of Florida to continue my studies of becoming a physician. This course has helped me decide what I want to become in the future by exposing me to a large amount of the medical field through our studies. I am currently an extern at A+ Urgent Care Off of Technology. I have observed and performed a large amount of different procedures, ranging from suture removal to the cleaning and draining of the sty, and much more. The CTE-ROP course has taught me the vitals of the medical field. I have learned how to draw blood from both the back of the hand and the antecubital regions, and give the proper injections, including Z-track, remove sutures, and much more. I would like to thank the CTE-ROP program for positively impacting my life by guiding me onto a great career choice that will help me become a physician and partake in the betterment of people's lives. Thank you. At this time, I will be performing blood draw. There are two types of blood draw. There's venipuncture and there's capillary puncture. The supplies needed for the venipuncture that I'm going to be performing is a needle adapter, a blood collecting needle, a lavender vacutainer for CBC, cotton swabs, band-aids, a tourniquet, and gloves. Lauren, this way please. Get the seat here. So what is your full name and your date of birth?
Lauren Showalter, November 29th, 1995.
Thank you. The three main veins in the antecubital region are the median cubital, which is right in the middle. The reason why this is the most favorited is it's easily identified. It is also well anchored down, and finally it is isolated from any other nerves or arteries. The second favorited is the cephalic vein, which is on this side, and then the last is the basilic, which is over here. This is the least favorited because it is near a nerve, and you risk damaging the nerve if you draw from it. Now I will begin the process of drawing blood. First, I sanitize my hands. This is following the infection control safety protocol by CDC that you must wash or disinfect your hands before and after gloving. I'm going to draw blood from her median cubital vein right here. And first step is to clean the area. I will use the inner-outer method. And next, while I let that dry, I will prep my supplies. I keep all my supplies on my left side so I do not cross over during drawing the blood. Okay. I will now apply the tourniquet. I will now release the tourniquet because I am only taking one vial. And now I release the tube. And then get the cotton swab ready and remove the needle while pushing down with the tube and put the safety on with the table. this time I will be performing an injection. There are 3 routes of injections. There is SQ, which is subcutaneous, which you deliver that in the fatty tissue of the tricep. There is ID, which is intradermal. You deliver that in the clear area of your forearm. And the last one is IM, which is intramuscular. If it's below 1 milliliter, you can give it in the deltoid, but if it's above 1 milliliter, you have to give it in the gluteal. For ID, you inject at a 10 to 15 degree angle. You do not aspirate or massage, and you gently stretch the skin for the puncture of the needle on the forearm. And for SQ, it is a 45 degree angle. You aspirate, you gently massage after the injection, and you separate these fatty tissue from the muscle. And for IM, it is 90 degrees. You also aspirate, you massage more vigorously to make sure the medicine has dispersed. And the doctor has ordered Toradol, and the calculations has come out to 0.75 milliliters. So now I'm going to withdraw from the vial the correct amount. First, I have to disinfect before and after gloving. Okay. Next, we check. There's 3 checks to make sure it's the proper medication. The first check is when we take it, or when the nurse dispenses it from the medicine cabinet, and then the second one is before we fill the syringe with the medicine, and the last is before we take the supplies to the room, the patient's room. So this is correct. And then there's also 8 rights. The first right, or the 8 rights are medication, time, dosage, right patients, the correct site, the correct technique, the correct right, and finally the correct documentation. So now I'm going to begin to withdraw the medicine. Okay. So we need to first clean the top of the vial just once so we do not reapply what we cleaned off. And while that dries, I will prep the rest. So the doctor ordered 0.75 milliliters. So I first aspirate, so it's easier to withdraw from the medication from the vial. And next, take off the cap. And you never point the needle at yourself. I'm flicking to get out all of the air bubbles. I do not fully recap. Next, I will remove my gloves that I used to fill the syringe. I will disinfect before. Now, since I just disinfected, I will head to the patient's room. You must always knock on a patient's door first.
Come in.
Thank you. So the doctor has ordered that we give you a Toradol shot, which will go intramuscular. So I'm going to have to give you an injection on your deltoid. Do you have any questions?
No.
Okay, thank you. Okay, so I will have her arm in a relaxed position because it reduces the pain of the injection, and I will give the injection about 4 fingers from the acromial, which is around the thickest part of the deltoid. So first step is always to clean the area of the injection. You go 4 fingers and use inner outer, and as I let that dry, I will prep my Band-Aid for after the injection. I'll place that on my non-dominant hand, glove, sorry. And I will also have the cotton swabs ready for immediately after the injection. So now I will always baffle up, and I will aspirate. There's no blood, so I inject. Withdraw, and immediately put the safety on and massage vigorously.